So let's jump right into pantoprazole. Um, it's this proton pump inhibitor, used to treat stomach ulcers, GERD-related erosive esophagitis, and even some of those hypersecretory conditions like Zollinger-Ellison syndrome.
Mm-hmm. Sure, and it's sold under the brand name Protonix, right? I'm curious, what really sets it apart from other PPIs?
Well, its mechanism is pretty interesting. Pantoprazole works by irreversibly binding to the H plus K plus ATPase in the stomach wall, which basically stops acid secretion for about
Yeah.
24 hours or longer.
That irreversible binding, wow, sounds like it really locks in the effect. So, it's available both as an oral tablet and an IV injection, correct?
Exactly. It's got that flexibility. The oral tablet is usually taken about half an hour before food for optimal effect, while the IV form is typically reserved for hospital settings, especially useful when patients can't swallow meds.
Right. And what about the side effects? I mean, most medications have them. What do we see with pantoprazole?
Common ones include headaches, diarrhea, abdominal discomfort, and joint pains. There are more serious, albeit rarer, side effects too, like severe allergic reactions or even some immunologic issues like Stevens-Johnson syndrome.
Mm-hmm. Yeah, I imagine with such potent acid suppression, there might be risks of infections too, like pneumonia in hospitalized cases, right?
Exactly, because stomach acid naturally helps kill bacteria, reducing it can sometimes lead to increased infection risk. Plus, with long-term use, there's evidence of nutrient malabsorption, vitamin B12, iron, even calcium deficiencies, and potential osteoporosis issues.
Yeah, I see. So monitoring is key for those on extended therapy. Now, I'm curious about its use alongside other medications. How do its pH altering effects play in drug interactions?
That's a critical point. Since pantoprazole reduces stomach acidity, it can interfere with the absorption of drugs that depend on a specific pH range, like ketoconazole, some iron salts, and even clopidogrel.
Mm-hmm. Speaking of absorption, its metabolism is mainly handled in the liver, isn't it? Something to do with the cytochrome P450 system?
Correct. It's primarily metabolized via CYP2C19 and, to a lesser extent, CYP3A4. You know, it's, like how you sometimes need to carefully time your coffee to match your morning schedule. Pantoprazole's timing ensures it hits its peak effect in 2 to 3 hours
Right.
after dosing.
And what about usage in children? I recall there's some caution there.
Yes, indeed. Its indication in pediatric cases is limited. It's approved for short-term treatment of erosive esophagitis in kids aged 7 and up, and really, its safety profile has only been well established in that context.
Mm-hmm. Got it. And in terms of pregnancy, I believe some studies in animals showed no clear harm at doses above the therapeutic range, even if we should still be cautious.
Exactly. Animal studies haven't shown evident teratogenic effects, but naturally, risks and benefits have to be carefully weighed when treating pregnant women.
Yeah. Shifting gears a bit, what about its history? I find that really fascinating.
Oh, absolutely. It has an interesting background. Pantoprazole was first developed around 1985, originally by scientists at a company that later became part of Altana. It entered the medical scene in Germany in 1994 under the Protonix brand in the United States after some licensing and patent maneuvers.
Mm-hmm. So it's been around for a while now and has clearly made a huge impact, especially since it's among the top commonly prescribed medications in the US with millions of prescriptions yearly.
Yes, it's one of those drugs that really helped shape modern gastrointestinal treatment strategies. Generics are widely available now too, which helps with accessibility.
Right. And speaking of diverse uses, I've also read it has applications in veterinary medicine. What's the scoop there?
That's a cool aspect. Pantoprazole is also used in several large animal species, like calves and goats. It's been shown to effectively increase abomasal or compartmental pH, providing gastrointestinal relief in veterinary settings.
Mm-hmm. Interesting. Though I wonder how much dosage adjustments are needed due to differences in metabolism among species.
Right. For instance, in goats, the elimination half-life is less than 1 hour compared to around 2.81 hours in calves. So yes, dosing definitely varies.
Yeah. Now, here's something I'm a bit curious, and correct me if I'm wrong. A point that somewhat troubles me is the long-term use leading to nutrient deficiencies and even rebound hypergastrinemia when stopping the drug. Thoughts?
You're absolutely right. That's an important concern. With long-term or high-dose use, there's indeed a risk of vitamin B12, iron, and calcium deficiencies because the acid reduction interferes with nutrient absorption. And when discontinuing, the rebound hypergastrinemia can cause a surge in acid production. It's why a tapering strategy is recommended if pantoprazole is used beyond 6 months.
Right, so it's really a trade-off, maximum acid control versus the risk of nutrient issues and potential rebound effects.
Exactly, it's like you're using a sledgehammer to control acid, but then you've got to slowly let go to avoid causing a mess with the body's natural regulation.
Yeah, and regarding its use in severe conditions like Zollinger-Ellison syndrome, this drug is quite valuable, isn't it?
Absolutely. For conditions with pathological acid secretion, pantoprazole is often a long-term treatment option to keep things under control.
Right. It's really impressive how a drug that works by just stopping a pump can have such far-reaching applications, from everyday GERD to complex hypersecretory disorders.
Totally. It's like a master key that controls the acid factory. Once you inactivate those proton pumps, the stomach has to synthesize new ones before it ramps up acid again. So, effective suppression is key to its success.
But don't you think that being so effective might sometimes be a double-edged sword? I mean, the same long-lasting inhibition that helps in treatment might also lead to some of those side effects we talked about.
I agree. That's a valid point. The irreversible binding is what makes it so potent. But if you're not careful, and if patients aren't monitored properly, you could run into complications like nutrient deficiencies or even increased infection risks.
Yeah. And what about its interaction with other medications? It seems like the change in stomach pH creates a ripple effect, affecting the bioavailability of various pH-sensitive drugs.
Absolutely. That's why clinicians have to be mindful. Drugs like ketoconazole or certain antiretrovirals may not reach their full potential in an elevated pH environment. It's a balancing act between managing acid-related conditions and keeping other treatments effective.
In summary, pantoprazole really is a unique drug, widely used with diverse applications across human and even veterinary medicine, but it also demands careful management.
Yes, it's a cornerstone in modern GI therapy. Its robust efficacy and acid suppression makes it indispensable, yet it also reminds us of the importance of dose management and monitoring long-term effects.
Right. Well said. Pantoprazole is certainly a fascinating example of how a targeted mechanism can revolutionize treatment and also highlight the intricate balance in pharmacotherapy.